The video you're about to watch was recorded back in May of 2021 during America's Frontline Doctors, the Uncensored Truth Tour in Cave Creek, Arizona. This was the first stop on the tour, and I had the opportunity to interview Dr. Simone Gold, the founder of AFLDS. This video was recorded for and uploaded to my good friend Spencer's YouTube channel, CFSM Media. Take a look at his channel in the description box below. Let's get straight to the interview. Hi, this is Vincent with CFSM Media. I have Dr. Gold here. Dr. Gold, the first time I saw you was in July 2020 on the steps of the U.S. Supreme Court. What was the reasoning behind wanting to come out, and how has that kind of changed your path in life since then?
Thank you so much. Everything has changed since then. I'm a board-certified emergency physician, Stanford University educated lawyer, and I was seeing the American people being lied to and patients actually being harmed. There were patients in front of me who would have benefited from life-saving early treatment medicine, and the hospitals and the governors were saying don't give it to them, which was unacceptable. That's actually why I got together with a lot of other doctors to go forward and talk about early treatment. Also, we wanted to talk about the harm of the lockdowns. So I spoke very early saying that this is a medical issue but a legal crisis, but that was the reason.
Very good. And so this is day one of the Uncensored Truth Tour. Tell us what it is and what the whole purpose is behind it.
So the whole purpose of bringing a tour to the American people is that there's been such a blackout, a news blackout, censorship. There's disinformation, there's misinformation, and there's flat out censorship. It's stunning. I know the American people understand this on some level, but I don't think they understand how deep it is. The AP has all gotten together, all the different news outlets, the big tech media companies, they've all decided to suppress news that they disagree with. I've never seen anything like this, so we decided just to bring the news directly to the people. You know, a lot of what I have to say tonight is really common sense, and all of what I'm saying tonight is publicly available on government databases like VAERS, the Vaccine Adverse Events Reporting System. So I'm just going to share the news that proper journalists should be sharing.
Very good. And speak of misinformation, Wikipedia describes America's Frontline Doctors as a, quote, right-wing political organization promoted by Tea Party patriots, and has opposed lockdowns and social distancing mandates by citing alleged and unapproved treatments for COVID-19. So since Wikipedia is propagating misinformation, please enlighten the viewers about America's Frontline Doctors.
Oh, so that's, first of all, kudos to you for getting a good question in. That's really clever. What I want to share about Wikipedia, because you'll understand how bad censorship is, many, many months ago, my team submitted to Wikipedia information about America's Frontline Doctors. They turned it down. They rejected it. They then put up their own version months and months later, which is astonishing, right? That's like asking Thomas Jefferson to have somebody else write about Thomas Jefferson, not Thomas Jefferson himself. So that's really the main takeaway. We are certainly opposed to lockdowns. They've done nothing to help the American people. They've done nothing to help people worldwide, but what they have done is cause tremendous economic harm. And the number one variable for your health really is poverty. If you live in poverty, you're much less likely to be healthy. So we are, of course, against lockdowns. We're in favor of early treatment. And the other lie in there is that we are entirely grassroots. We're grassroots physicians, and now we're supported by small dollar donations from the American people.
Yeah, that's very exciting. Wikipedia is not really what they used to be, I guess, many years ago. So there are employers out there who mandate things like COVID testing, maybe COVID vaccines, masking, and a host of other medical interventions under the guise of health and safety. What is America's Frontline Doctors' position on such policies? And if an employer mandates masking and such policies that might make an employee feel uncomfortable, what can the employee do about it?
So America's Frontline Doctors exists to empower the American citizen to push back and assert their legal rights. It is absolutely illegal for an employer or business or anybody to mandate any treatment while it's still experimental. Currently, the vaccines are under an EUA, emergency use authorization only. They're in investigational stages only. At this time, it cannot be mandated legally. Anybody who feels that they're being pressured illegally to comply with the medication that they don't want should visit americasfrontlinedoctors.org and go to the legal section, read up on all the stuff we have on masks and vaccines, determine if you need to speak with an attorney, and if you do, we try our best to pair with an attorney in your state. If you don't assert your legal rights, you will lose them. The situation will change once the emergency use authorization is lifted. That normally should not happen until medical trials are complete, which is all the way until April 2023. However, we hear that they plan to try to remove the EUA early, like as early as this summer, which means that the American people are getting shortchanged from having the completion of medical trials. So we intend to bring litigation to force the FDA to follow its own rules of completing the medical trials before granting full approval.
Yeah, and hopefully that goes through. Hopefully we're able to get the pushback that we need on that. Last question for you. So critics of America's Frontline Doctors state medical interventions like vitamin C, vitamin D, zinc, hydroxychloroquine, azithromycin, ivermectin, and the like, they state they're, quote, without peer-reviewed evidence and lacking formal approval from health bodies. Isn't this a bit hypocritical, considering the PCR testing and COVID vaccinations are not formally approved from health bodies and are lacking peer-reviewed evidence?
Yes, so there's now more than 300 studies showing early treatment works. About 250 studies or so showing hydroxychloroquine works, especially in early stages. I think almost 50 at this point for ivermectin, also budesonide, vitamin D, zinc, very, very important. Prednisone, azithromycin, other things. There's plasma antibodies. There's also remdesivir, though not very effective. It is a treatment. There are lots of early treatments. The reason the pushback is so severe against early treatments is that if there's an acceptable early treatment, then the vaccines cannot be rolled out prior to the completion of their medical trials. So they're screaming as loud as they can that there's no early treatment. However, we have data from all over the world. Are you going to say there's a collusion all over the world? 250 hydroxychloroquine studies, 50 ivermectin studies from every continent except Antarctica, really. So of course early treatment works. And I want to leave people with the idea that do not be panicked over this virus. SARS-CoV-2 is actually a very trivial virus in the scheme of human history. Early treatment works. You're going to be okay.
Right, and even vitamin D. Vitamin D has been seen for the past 70 years of clinical research, and I remember reading a study back in 2010 where they called vitamin D the pandemic that nobody's talking about, and the results of that study showed that 1 out of 8 people around the globe are vitamin D deficient, but we've seen that vitamin D deficiency results in a 95% greater chance of death, 90% chance to go to the ICU for COVID, and 50 to 60% greater chance in not even contracting colds or flus. So the importance of vitamin D is definitely there.
You know, you are exactly correct. I want to give you props for being accurate. Vitamin D is incredibly important. They are going after doctors who are advising vitamin D because they understand that if they agree that other treatments work, they won't be able to rush the vaccines through.
All right, thank you so much for your time, Dr. Gold. I really appreciate it.
Thank you so much.